Hey, what's up, everybody? CNBC article here this time we're going to go ahead and look at. I don't know if you saw this story, so just putting it out there for you. And you know it's going to happen. You know it's going to be happening over and over and over again. I see these odd articles sometimes. Let me give you the title real quick here. How women could be uniquely impacted by the coronavirus. Just women? Everybody? One of these CNBC articles I saw a while back, I didn't get a chance to cover it. I think it was actually before I started making videos, but it said something about how trans people's finances could be complex or complicated and they need special help. And it seemed like they were trying to direct you towards a trans individual to help you with your finances. And it's like, finances are finances. The numbers are numbers. Anybody can help you. And that's kind of the whole, what would you say, kind of like the grifting thing. Snake oil sales, giving people advice that isn't necessarily correct. You can get help anywhere. Tying that to this, it doesn't give a fuck what color you are, religion, race, gender, it doesn't care. But let's go ahead and take a look at the article. I'm ranting. As the coronavirus continues to spread globally, some healthcare professionals and experts have growing concerns about how the virus could disproportionately impact women. Right now, women in the U.S. hold 76% of healthcare jobs, according to the U.S. Census Bureau. That seems disproportionate. I think we need to get some more men in there. Just messing with you, ladies. In nursing, where workers are on the front lines of patient interactions, women make up more than 85% of the workforce. It's a little scary, says one registered nurse who works in the Washington, D.C. area, who asked not to be named to protect her privacy and employment. In the past, she's worked with patients who've had the flu, tuberculosis, and other communicable diseases, but the coronavirus is different. She tells CNBC Make It. In addition to the virus having no vaccine yet, the rush of people being infected has led some healthcare workers being fearful that they may contract it as well, she says. I've had to ask myself, what if I got exposed to the virus unknowingly, and now I have to go back to family members who are in the age bracket of 60 and above, or even younger family members with a weak immune system. Though her hospital won't reveal the exact number of patients infected, the 25-year-old nurse says she's aware that they've had to place several patients who tested positive for the China flu in quarantine. It says here women make up a majority of healthcare workers worldwide. So we saw information on that. It says here roughly 70% of the global healthcare workforce is made up of women, according to an analysis of 104 countries conducted by the World Health Organization. So what you're telling me is you have a field that's pretty much dominated by women, but now you're trying to complain that women most affected? Well, just let that one sink in for a little bit. We can get the push going. We can get some more men in nursing. Those are nice jobs. That being said, I got love for all the nurses out there. It's personal for me. I have a lot of loved ones who are nurses, so it's personal for me. So I got nothing but respect for all the healthcare professionals, nurses, doctors, RNs, CNAs, RTs, PTs, the support staff that helps them around the hospital as well. So got nothing but love for the healthcare profession. And as I've said in my other videos, yeah, they're definitely in a bad spot right now. They're on the front lines out there along with other EMS individuals. So definitely hats off to all them. Much respect. So we'll skip ahead a little bit here. It says women are primary caretakers. In addition to women making up the majority of healthcare workers in the U.S. and globally, women are overwhelmingly the primary caretakers in their families. This means that many women in healthcare are balancing a demanding working life and home life, Nielsen says. Today, more than 75% of caregivers are women, according to the Family Caregiver Alliance. Though men also provide assistance, data shows that women spend as much as 50% more time caring for a family member than men. Skip down here to the last paragraph, something interesting that I didn't know. Maybe you'll find it interesting, but it says here in Washington state, one of the states that has been hit the hardest by the coronavirus, Governor Jay Inslee asked district superintendents to provide free childcare for healthcare workers and first responders who need to be at work. At UW-Medicine, a hospital in Seattle, clinicians have received emails from the Human Resources Department about plans to activate additional resources. This includes working with local university programs to match accredited students with an interest in child development to families in need, according to emails reviewed by CNBC. So far, there is no word yet on when these plans will go into effect. Now, this is actually going to be a companion video. I'm going to do a second video, so check that out as well, but I'll put a link below to it. Try to have them both up around the same time. It's going to talk about a different aspect and who's impacted. So it'll be interesting. You'll see, you'll get one perspective here, and then you can check out a different source and get a different perspective. But again, I've got nothing but love for nurses and nothing but love for those in the medical profession. Again, heroes every day. Same with EMS, teachers, individuals like that. All those individuals always get respect from me because they're out there doing the tough jobs, dealing with kids, dealing with patients, whatever career you're talking about. But specifically on nurses, since this is what the article is about, yeah, they definitely have it tough, and you all know that. Doctors as well. And obviously EMS, we can't forget about them, but they don't have the option like the rest of us do to chill out at home and hide out from the virus. Not only do they have to go out to work, they're also out there on the front lines where the sick individuals are at and where they're headed. So it's definitely a tough time to be a nurse, and they are one of the most well-respected professions for a reason. It seems like yearly they're always ranking pretty high up there. Now, in terms of the article and its impact on women, yeah, sure, you can take one industry and say, hey, coronavirus, women because of healthcare. And definitely, I get that. It's actually 100% a valid point when you just look at nurses. But if you take a look at the overall impact on society as a whole, which is going to be my other video, then you'll kind of see a little bit of a different narrative starting to take place. So look out for that second part. I'll link it below. I'll try to have them both done about the same time so I can put them up together and make them as like a brother-sister kind of combo thing. But interested to hear what you think. Do any of you have any loved ones in the nursing profession? And if so, how are they coping with it? Thanks as always for watching this video, everybody. Take care. And if you do have nurses in your family, hey, tell them the dose sends them some love, and definitely let them know how much we all appreciate all the work they do. Everybody who's out there who doesn't have the option like most individuals do, or maybe not so much an option, but to where they're able to stay home and kind of hide out from this. So thanks for watching as always, everybody. Take care and have a good day.